speaker plenty of time. My name is Jennifer Trotter, and on behalf of the Global Alzheimer's Platform Foundation and Kerwin Memory Center, I want to thank you for joining our third webinar in our Staying Ahead series today. So before we get started, I'd just like to remind everyone to please make sure your phone or your computer is on mute while the speakers are presenting, because any background noise can make it hard for others to hear. Also, if you have questions or comments, you're welcome to leave those in the chat box at the bottom of your screen. We'll have time for Q&A at the end of the presentation. And I can assure you that if there are any questions that we don't have time to answer, we'll make sure to get an answer sent to you if you include your email address. The Global Alzheimer's Platform Foundation is a nonprofit organization whose mission is to speed up drug development for Alzheimer's disease. We work closely with our GAPNet sites like Kerwin Memory Center to help these research sites run important clinical trials in order to efficiently get therapies to the people who need them faster. Today's topic is staying ahead by staying healthy. We're going to hear about the connection between brain and body, strategies to improve health, the mind diet, and many other helpful tips. Today's discussion will feature Dr. Diana Kerwin, President and founder of the Kerwin Memory Center in Dallas, Texas. A little bit about Dr. Kerwin. Dr. Kerwin completed internal medicine residency and geriatric medicine fellowship training at Northwestern University Feinberg School of Medicine in Chicago, Illinois, and she specializes in cognitive disorders. Dr. Kerwin is the president of Kerwin Memory Center in Dallas, Texas, and an adjunct assistant professor in the Department of Neurology and Neurotherapeutics at the University of Texas Southwestern Medical Center in Dallas. Prior to moving to Dallas in July of 2013, she was an assistant professor of medicine geriatrics at Northwestern and faculty in the Northwestern University Cognitive Neurology and Alzheimer's Disease Center. Dr. Kerwin is the principal investigator on several phase 1, 2, and 3 clinical trials for the development of therapeutics in Alzheimer's and other dementias such as progressive supranuclear palsy. She's the principal investigator for several NIA-funded studies on the prevention of Alzheimer's disease and collaborative studies for patients with frontotemporal lobe dementia syndromes. Dr. Kerwin's areas of research and clinical interest include the prevention of cognitive decline and dementia. She has lectured extensively on cognitive aging and Alzheimer's disease. She currently serves on the National Board of Directors for the Alzheimer's Association and is the academic partner on several community initiatives to improve the care of senior adults with dementia in underserved areas. Her award-winning research on the relationship of obesity and memory function in women has been featured in Time magazine, the BBC, the Boston Globe, and on local and national news programs. So as you can see, we're in for a treat today. Please welcome Dr. Kerwin.
Let me unmute myself. Great, good afternoon, everybody. Thank you for joining us today. I'm beginning to look forward to this type of format of Zoom talks with audiences. It's not quite as interactive, but I hope that we'll be able to really share a lot of good information for you. I always enjoy focusing on brain health rather than brain disease. But just so you know, my talks, I tend to like to be able to kind of give a backdrop of kind of a lot of times people are tuning in because they're concerned about Alzheimer's or they have a family member or themselves. And so I am going to give a good background on Alzheimer's and where we are with diagnosis, where we are with studies, but then also give you some basics of what we do know about diet and other aspects that can help you with brain health. I am an internist and a geriatrician, but I specifically went into geriatrics to do Alzheimer's research. And actually now I've done research in several different neurologic areas. So sometimes we focus on Alzheimer's, but I know that many of you in the audience may have family members or know about diseases that are non-Alzheimer's related dementias. So I will be talking about some of those, and if you have questions about those, I will make sure we have time at the end of the talk to be able to answer questions. And fortunately with this type of Zoom format, we always have email and other ways to communicate after this. So I'm located in Dallas. I've been practicing in Dallas since 2013. Prior to that, I was born and raised in Chicago and did the majority of my training in the Midwest. So living in Dallas now, just since we're talking about brain health, I'd like to talk about general health first. Just make sure everyone has their hand sanitizer, everyone has their mask. We have coronavirus on top of many other aspects of health that are affecting us on a daily basis. And so just want to be sure that everyone's staying safe with that as well. You can go to the next slide, Julie. Great. So every year, these are some of the basic statistics we know about Alzheimer's and other dementias, but every year we learn more and more. So these get updated by several different groups, the Alzheimer's Association, Us Against Alzheimer's, several other groups. This is basically a compilation of all researchers around the world and what we learn about Alzheimer's, year after year. It's much different now than 10 years ago or even 18 years ago when I started in this field. Some of the main differences that have come up that we've learned in the last 10 years is the impact of Alzheimer's on women. Women are at greater risk. A woman at the age of 65 actually has a greater risk of developing Alzheimer's in the duration of her life than developing breast cancer. So when we think about, women's health, you have to think about Alzheimer's in that group as well. Women also tend to be caregivers, both paid and unpaid. So they oftentimes are dealing with it both on caring for a loved one as well as worried about their own brain health and what might happen to them as they get older. So for anyone who is a caregiver, I'm glad you're on this line because this is really meant to help provide you information to take care of yourself. If you are taking care of someone else, we want you to be sure that you're putting your health first as well, because the healthier you are, the better you're going to be able to take care of your loved ones as well. Since I am in Texas, we talk a little bit more about our local numbers. So in Texas, there's about 340,000 people that are believed to have dementia. If you look at the prevalence of dementia in the United States, the prevalence in Texas, it would be about 340,000. Of that, it would be 220,000 of those would be women because women are more greatly affected. So just to remind everybody, prevalence means the number of people that have the disease. And prevalence can increase if we have more disease cases that are being detected, but not necessarily new cases. So we have a higher prevalence of Alzheimer's and dementia now than we did in years past. Many of it is because people are living into the age range that it's at higher risk. So more people are living over the age of 65 and longer. And every decade after 65, the risk of developing Alzheimer's goes up higher and higher. So one of the reasons why we're seeing more cases is not because each individual person is at greater risk now than you were decades ago. It is because as a society, we're living longer. We're not dying of heart attacks and other diseases because we're doing a better job in those areas of healthcare. But now you're living longer to the point where you might develop memory impairment and a dementia if it starts to cause problems every day. So the importance of this is that we now have to have dementia and Alzheimer's treatments catch up to the rest of healthcare. We need to have treatments that are as aggressive and effective as we see in heart disease, in infectious disease, and in cancer. And to do that, we really have to learn about the disease and then develop treatments and prevention. Both are important in really stopping or reducing the number of people that are affected as they get older with dementia due to Alzheimer's or other dementias. You can go to the next slide. So I always put up this slide because one thing I learned when I was in medical training, first of all, I went off to medical school and I came back home and I spoke a new language to anyone who wasn't in healthcare. It's a whole different language if you're not careful. But even when you get into the specialty of dementia and cognitive disorders, this gets even confusing for other medical professionals who aren't as familiar with these terms. So I like to walk through the terms to make sure we're all talking the same language. So the first part, when I say dementia is actually a fairly broad term. It's something that doesn't take a lot of medical training to actually identify. You can come in contact with someone that's in the middle or even the early stages of a memory impairment that's causing now daily difficulty. And you can actually start to notice that, oh, that person's repetitive. Oh, I have to keep reminding that person what the date is. I have to keep reminding them of my name. They keep asking the same question. So that is the dementia symptom that's expressing itself for that patient. So dementia is actually just means that the person is having something affecting their brain function that is now affecting their ability to independently function every day, different than how they were in the past. So that's the difference. You have to have some memory impairment that's different than you were before. So for instance, when I was in residency at Northwestern, we had this big tower parking garage. And because I was often distracted when I was parking and running into the hospital, as I came out, I might forget where my car was. That didn't mean that I all of a sudden had a dementia. I probably was sleep deprived or something, but that was just sort of, I was distracted and something else was going on. If I started to do it now and I was parking in a very familiar place and I wasn't distracted and I came out and said, I think my car's been stolen, that tells you that the memory impairment now is affecting my ability to function daily, and it may start reach the criteria of a clinical dementia syndrome. So dementia is kind of this broad term. It's like saying I have a cold. Well, colds can be caused by many different viruses. So dementia is saying I've got something affecting my brain function, and it could be one of several different diseases. And so that's where the diagnostic evaluation comes into great importance, because knowing what is causing that decline is important not only for that person to understand it, but for us to be able to treat it, for us to advise you, and for you to kind of know what life is going to look like with this disease state. So that's why the diagnostic evaluation as early as possible is really important. Some of the diagnoses that are possible in the dementia category, Alzheimer's. And the reason why we talk about Alzheimer's the most when you talk about dementia is it's the most common. It accounts for about 60 to 70% of all dementia. So if I have 100 people in front of me with a dementia type of diagnosis, about 70 of them are going to have an Alzheimer's type of dementia, and then the other 30 are going to have something in some of these other categories. Alzheimer's is known for being more prominently memory impairment, mostly short-term memory impairment. So oftentimes we make the diagnosis by measuring memory. That's not the same for some of the other dementias. The other dementias can affect areas outside of memory. In fact, memory can be very good. So for instance, a vascular dementia, which is usually someone who's either had a very large or small strokes over time, can start to have a decrease in their cognitive abilities. Oftentimes it's their judgment, their safety, their planning, their ability to do the checkbook and things like that. It's not as much a memory impairment. Same can be said for something like a frontal lobe dementia, which there's several categories there. Some are called primary progressive aphasia, where the person can come in and is having just language difficulty, but their memory is actually very good. So the question came up of clinical syndrome. So when we say a clinical syndrome, clinical means it's a presentation that is visible or testable in the office. So it's not something, it's something that you can test and determine during an office visit or by a physician. Clinical syndrome means it's not just a pathological diagnosis. So for instance, when we talk about Alzheimer's, there's actually something that goes on in the brain that can happen before the person has memory impairment. So the underlying Alzheimer's in the brain is what we call the neuropathology. It's not a clinical syndrome unless when you come into the office, I test you and I find that there's some type of impairment that's detectable by some type of test. So either a memory test or some type of examination. So again, I'm going back to primary progressive aphasia. That disease affects mostly the language areas, but not the memory areas. And then there's another disease called Lewy body disease that we do see fairly often. It's actually probably the second most common cause of dementia. And this is often people that come in and they're mistaken for either Parkinson's disease or Alzheimer's with Parkinson's. But it is a different type of disease called Lewy body, and it has a specific type of presentation. Usually it's memory impairment that really comes and goes very drastically. They can have days where they're very clear and you test them and they test very well on memory tests, and then some days that they're very confused and don't even recall events of that day. And it's oftentimes associated with either falls or stiffness or what looks like Parkinson's disease, but it actually is a disease separate from Parkinson's disease. So when you get into it, as you can hear as I describe some of these dementias, and I'm not going to describe all of them, there is a lot of nuances and a lot that the doctor needs to be thinking about when a person comes into the office for an evaluation because they don't feel that their brain is functioning as it has before, and they're worried that there's something happening, or they want to know what's causing it. So we can go to the next slide. And you can click it again to go forward. It'll progress, it'll fill in some words. Yep, one more time. So when I talked about dementia being a clinical syndrome, again, that's the one that's the outward appearance of the disease state. That's the one where, again, it's recognizable when you interact with the person. When you interact with somebody, you don't know what's really going on in their brain tissue. So this is what happens in Alzheimer's disease. And the reason why what's happening in the brain tissue for us is important, not because it's a diagnostic indicator right now, but for treatment developments, when we realize where things go wrong, why does a person with Alzheimer's or who presents with memory impairment and dementia have these two abnormalities? On the right, it's what we call a neurofibrillary tangle. It's where the normal neuron in the brain has the tau protein inside has become abnormal and is starting to basically twirl up. It's been phosphorylated, and so then the skeleton of the neuron shrivels up, and that neuron now is no longer functioning. And in the other side, on the left side, it's an amyloid plaque, which is a protein that gets deposited that we're not quite sure if the amyloid protein causes the neurofibrillary tangles or vice versa. But one of the big areas of therapeutic development is, and both prevention is, can we prevent you from getting amyloid plaque or neurofibrillary tangles in the brain? Or if they do develop in your brain tissue, can we develop a medication that goes in and removes or stops the production of those two abnormalities? Because we know that everyone with Alzheimer's has this in their brain tissue when we do look at it after their death. And the importance of this is we're talking about brain health. And so I do want you to understand that there is, when we talk about prevention, we're talking about, can we slow down or stop the accumulation of these abnormal proteins in your brain tissue so that you never get to the point where there's a memory or significant memory impairment? Or can we get to the point where if you do start to have memory impairment, can we really slow it down more by keeping your brain healthy, by slowing down some of these processes? And we're finding in research is that things like diet and exercise actually do affect the levels of these proteins in your brain. So when we're talking about it, it may not be a complete prevention where you'll never have an abnormal protein in the brain develop, but if we can keep you from having a more significant impact of the memory impairment that develops because of these abnormalities, that is really where preventatives are geared. And we have found that those can be effective. So you can go to the next slide. Oh, one more, sorry. So the reason why I put up risk factors for Alzheimer's, and this is for other dementias, I'm going to focus a little bit more on Alzheimer's for this one. The reason why we want to know what risk, what causes a risk for somebody is because when you're developing a prevention plan, that's what you're going to focus on. What risks are changeable or what we call modifiable? So there are certain risks for Alzheimer's disease that we can't change. I can't change my age, can't change my gender. So we know that the older you are, the higher risk of developing Alzheimer's. We know that women have a greater risk than men. The importance of knowing those two things is that we can start to look at why certain people, why do 80-year-olds, why do some 80-year-olds or 85-year-olds develop Alzheimer's and some don't? So we can start to look at what are differences in why someone gets it and doesn't, to try to figure out if there's a way for us to duplicate the protective factors that occur for somebody. And then for the gender difference, although we can't change people's gender, it helps us in research because we can start to look at what could it be in a woman, what could be different in a woman versus a man that would make a woman at greater risk. So there's been a lot of research that's gone into, is there changes in hormones, menopause, is there certain things that women are exposed to that can help us to understand maybe why this pathology occurs. The other things that you can't change are your genetic makeup. So some people are born with a gene that can increase their risk of developing Alzheimer's. The gene is called the ApoE gene. There's one of 3 different types that you can inherit from your parents. It's actually not an Alzheimer's gene, it's actually a cholesterol carrier gene, but there's 3 different types. And if you get the type that increases your risk of developing Alzheimer's, that's one of the things that we've learned in studies. And it's one of the genetic markers that we look for in research because some medications work better for people depending on what their genetic ApoE carrier status is. And so those are called ApoE 2, 3, or 4. The second genetic risk is actually what is called an Alzheimer's gene, meaning that these genes, if you're born with it, you will develop Alzheimer's at some point in your life, and usually you'll develop Alzheimer's at the same time point that your parent who has the gene, because you'd have to have one parent with the gene in order to inherit one of these, but you would get it about the same time that your parent who has the gene developed it. So this is where the study in Colombia, if you've seen any of the news cycles about the Colombian or the South America study, there's villages in Colombia, South America, that whole families will have a high prevalence or high rates of Alzheimer's, and it is because they are carriers of one of these Alzheimer's genes, which are called APP, presenilin 1 and presenilin 2. These are a much more rare type or risk of Alzheimer's. They account for less than 250,000 of the cases, and they do tend to be a younger onset of Alzheimer's. This is not the typical Alzheimer's cases that you'll see that is age-related, not really genetically related. So although your genetic makeup is important for age-related Alzheimer's, the genetic component is not the only thing that's causing us to see Alzheimer's in people over the age of 65. When I see a patient under the age of 65 or very young, and I've had patients even in their 40s, I test for these younger Alzheimer's risk genes or Alzheimer's genes, because those are the ones that are more likely to cause a young patient to develop Alzheimer's, not like the typical late onset Alzheimer's that we're usually talking about. So hopefully that's clear. So what are modifiable risk factors? And these are where the research on prevention has really focused and is really getting stronger, where we're able to advise people now on how can they keep their brain healthy, what to talk to your doctor about in order to reduce your risk. So modifiable risk factors are things you can do something about. So one of them is blood pressure. We're learning now, there's decades of research showing that people that run high blood pressures, even slightly high, meaning greater than a systolic of 140, normal blood pressure is 120/80. That upper number, the 120, is called a systolic blood pressure number. We found over the years of looking at observational studies, people who run a higher blood pressure had increased risk of developing dementia due to Alzheimer's and also stroke-related dementia. So there's been a lot of studies now that have looked at, well, what if we can really aggressively lower blood pressure? Would that decrease the risk of someone developing Alzheimer's? There was a study that came out called the SPRINT study that showed that patients that did have more aggressive blood pressure control seemed to have better cognitive performance and slower rate of cognitive decline, and then also a protective factor from the development of dementia. So there was a study that was so effective that they actually stopped the study, and it's now being looked at more closely of, can we use blood pressure control as a treatment? We're also doing a local, you had Jeff Burns was on this series once before. He's one of our investigators on a study called RRAD, which is a risk reduction in Alzheimer's study that we're doing at UT Southwestern in Dallas, Kansas University, and also Pennington and WashU, where we're looking at blood pressure and cholesterol lowering and how much can we lower someone's risk of developing Alzheimer's. And that study is ongoing currently, so we should have more information there. There's also another study called the US Pointer study that is a prevention study looking at exercise and other modifiable risk factors and how does that decrease your risk of developing Alzheimer's. We do know that exercise has a very beneficial effect, and I believe Dr. Burns talked about that. Exercise, cardiovascular exercise where you're getting your heart rate up, you're getting a bit of a sweat done safely, actually has both short-term and long-term benefits to brain health, and even lowers the amyloid burden in the brain. So that amyloid protein I talked about that causes Alzheimer's is one of the things you can actually directly affect through exercise and diet. And then there's diet habits. There's some good data. I'm going to talk about something called the MIND diet, M-I-N-D. We actually have magnets that we give out, and I'll show some visuals of that. But there is information that a certain type of diet can actually lower your risk of developing Alzheimer's as well. And then other things that can contribute, things like inflammation. So having a chronic inflammation, like having chronically poorly controlled diabetes, poorly controlled heart disease, poorly controlled other comorbidities can increase your risk. We also know there's a new association with gum disease. So there's actually one company that's developing a treatment geared at something that occurs when you have gum disease that seems to be increasing risk of Alzheimer's. And then there's other things like is your health in general, your gut microbiota, we call it, or what's the bacteria in your gut, Is it a good balance? And that has been linked to other neurologic disorders. And then glucose and insulin. So that's where good diabetes control, as well as a good diet that helps you maintain a healthy glucose level, is also known to be healthy for your brain. We'll go to the next slide. So I put this up just because I thought this was interesting. I liked this study. This was from 2019, and this was, what did people perceive would be helpful to reduce their risk and this was in people age 50 to 64. So number one was, did they discuss ways to prevent dementia with their doctor? And you can see that's the first two columns. Not a lot of people are discussing this with their doctors, and this is where I wish it would change. As we get more prevention information, changing that discussion with your doctor of what could I be doing? What's my blood pressure? Is my diabetes well enough controlled? Maybe do I need to exercise more? How could I do that safely? Those are things that your primary care doctor can provide you information for. Although they can't tell you, yes, I can help you prevent Alzheimer's or dementia completely, there's things that they can give you guidance on. Other things they can give you guidance on is supplements. So a lot of people believe that fish oil and omega-3 is likely to prevent them from developing dementia. There's some data there, but the data actually is more on getting fish oil and omega-3 fatty acids from the food you eat. So trying to really look at your diet before you go to a supplement. Another one that comes up that's interesting is ginkgo biloba as a supplement. Ginkgo biloba has been advertised as a Alzheimer's treatment or preventative. There's been large studies done, and it's never been shown to be truly effective in treating Alzheimer's or preventing it. So it doesn't tend to be one of the supplements that I talk about. There are other supplements that you can talk about with your doctor. Yes?
I have a question. Does omega-3 prevent dementia?
So I have more information on omega-3. So if you hold on and we'll get through more of the presentation, we'll be able to talk about that.
Okay.
So some of the other supplements that you can talk with your doctor about are B vitamins, or should you be taking something like an antioxidant like vitamin C? But that is something that people perceive as being beneficial, but not all of them are. The one that is really interesting to me is crossword puzzles. Look at how many people believe that crossword puzzles may be somewhat likely or not likely to help them. So that's kind of equal. That kind of goes along with keeping your brain active. So crossword puzzles are not magical in and of themselves, but someone who's doing crossword puzzles is probably doing something that's keeping their brain active in other ways. So it is part of an overall brain health regimen that you should think about, but it's not going to be the only thing that's going to help you. You can go to the next slide. So how is a memory diagnosis made? And I do this because it helps then with that discussion about supplements and what you should be doing. So right now, there's no blood test for Alzheimer's. There are blood tests being developed, and in fact, we're going to be doing a biomarker study, but we don't have a blood test yet where if you go to your doctor's office and say, I'm worried about Alzheimer's, I'm having some memory difficulty, can you do the blood test and see if I have Alzheimer's? That doesn't exist yet. There are some scans we can do, but they are not yet available broadly because there's a cost issue to them. So really the main way to diagnose a memory impairment due to Alzheimer's or some other brain function issue like the other dementias I talked about, the doctor has to do a thorough history, talking about where are you having difficulty, when did it start, what's the pattern, is it more memory or is it more language, or is it more you're having sleep difficulty or changes in your personality, because that will help the doctor make the right diagnosis. And then the doctor has to do testing of you. And the basis of it is really memory testing. And it's memory testing, not saying, oh, everyone has trouble with their memory as they get older. It's memory testing taking into account how old you are, how educated you are, and other factors that go into being sure that when we test your memory, I'm testing how good your memory should be performing versus how you're actually performing. And if there's a difference between those two, that means there is a memory impairment. And that's not really related to just normal aging. When we test, because we take into account age, you can't just say, oh, it's just because I'm 65 years old, because we've already taken that into account. So you have to make sure that those numbers are looked at appropriately. Once we do a test and determine that there is memory impairment, then we have to determine why. There's lots of things that cause memory impairment besides Alzheimer's disease. And so that's why getting in for an evaluation, if you're concerned about your memory, is important to do. So there are things that can come up on your blood work. if you have undiagnosed diabetes, if you have undiagnosed thyroid problems, if you have an undiagnosed vitamin deficiency like B12, that can all cause memory impairment and present to the office in that way. So that needs to be looked at. You also have to look at the brain imaging. Anyone presenting with a memory or brain function change should have their brain imaged, because to make a diagnosis on the organ that we think is causing the problems, you really need to image it and say, was there maybe a stroke that you didn't realize you had? Or is there something happening, or does the pattern on the brain imaging tell me it looks consistent with or not with an Alzheimer's process or some other disease? And there are different patterns of what we call atrophy or shrinkage of different areas of the brain that we can see on the MRI or CAT scan that can help us make the diagnosis. It can also help us rule out other things like a hydrocephalus, rule out any large strokes. That can help us with the diagnosis as well. So with all of that, it is a big evaluation. And so that's why for primary care, it can be very difficult for those workups to be done completely with your primary care doctor's office. But the conversation needs to start with your primary care doctor. As a specialist in memory, the one thing that I like to do is team up with the primary care doctor so that they know that if they would like to send someone to me for memory evaluation, if they go ahead and do the blood work that's needed and do the brain imaging that's needed and ruled out that your thyroid's normal, your B12 level is normal, your kidney and liver function's normal, the brain MRI doesn't look very consistent or isn't telling them the diagnosis, and then sending them over to a specialist for a more in-depth evaluation can be very helpful to help expedite or facilitate the evaluation for people. So starting with your primary care doctor is important, although they may not be able to make the diagnosis fully. And there are blood tests that, like I said, that are in development. We just don't quite have them yet. You can go to the next slide. So how do we test memory? So to test memory, it's not just, and this is where it gets confusing, of short-term memory versus long-term. So if someone can remember things from 50 years ago, but can't remember something from 5 minutes ago, is that still a memory problem? It is, because short-term memory and long-term memory are stored and managed very differently in the brain. So we're typically looking for short-term memory impairments. But memory in and of itself requires certain aspects as well. So if you're sleeping right now, or if you can't hear me, or if you can't see me, and I show you something and you can't see it, and I say, remember that, and you can't remember it, that doesn't mean you have a memory impairment. If you're not paying attention, if you're on your phone or doing something else right now, which can happen on video calls, and I give you something to remember, you likely won't remember it, and it doesn't mean you have a memory issue, it's because you were distracted. So the first thing about memory is the person awake, alert, attentive? Did they get enough sleep last night? And then I can give you something to remember, and that's called encoding. So oftentimes for encoding, on one of the most common tests we give, called the Montreal Cognitive Assessment, we give somebody 5 words to remember. So that's the first thing, is I'll say 5 words to you, have you repeat them back to me twice. That's encoding. That's where I give you something to remember, and then we see what happens to that information. We can go to the next slide. Sorry, this one has a couple clicks. So the next part is, when I give you those 5 words, you're probably going to put it into a short-term file. You're not going to remember those things for years and years. You might if you do the test a lot of times, but you're going to put it in a short-term memory file. And that's oftentimes the memory that we're interested in for Alzheimer's, because that's the area that's affected first. So you might store it in a short-term file. This is the area where, if those neurons in your short-term memory area, which is called the hippocampus, is starting to be damaged by Alzheimer's, this is where we can pick it up early, because short-term memory is stored in that area that Alzheimer's affects first. So that's the hippocampus area. You'd be storing it there. And then a few minutes later, we can go to the next slide. I will say, what were those 5 words? And that's called retrieval. So now, if you can just get those 5 words out to me right away, that doesn't mean there's no memory problem. It means it's probably not as severe, or we're going to have to do more in-depth testing. If you have trouble with those words, getting them back to me, say you get 2 of them to me out of the 5, and I give you some hints about the other 3, and you get all of the other 3, that means it's a retrieval problem. And that doesn't tend to be Alzheimer's. Retrieval problems tend to be if you didn't get enough sleep, if you had a small stroke, sometimes medication. Other things can cause retrieval problems. And also normal aging. Normal aging can affect our retrieval the most. Our files are there, the information is there, but getting that information back out takes a much longer time, and sometimes we have to help ourselves. So that's where doing memory, trying to do things that help you remember something, like associating a color with somebody's name, or some type of memory or music with something you're trying to remember, or movement, can help you retrieve that information more easily and overcome some of the aging related changes. Now, if you don't remember any of those words, that tells me that there probably is some type of process going on in the short-term memory areas, and I'm going to dig a little bit deeper and see if it's an Alzheimer's process. So you can go to the next slide. And you can do a couple more. Yeah, these little graphics will come up. So for encoding, some of the ways you can improve your encoding of your memory is by getting a good night's sleep, so good quality sleep. Exercise can help you be more attentive, to be able to take in new information. Having a good nutrition as well, and not being distracted can help you to encode information and have a better memory. Storage, there's not as much we can do about that, but there are memory, exercise will help you increase your overall brain health and help you to remember things better and store them better, but also doing things like memory tasks. So that's where crossword puzzles, trying to really exercise those memory areas, can help you maybe store the information more efficiently. And then retrieval is really going to be affected by the brain health as well. And that's going to be also improved if you do exercise, good diet, will help you with your retrieval. So those are some of the areas of memory that you can focus on for your own brain health. Go to the next slide. So this is just a picture of one of the typical tests we do. It's not the only test we do, and it's not the end all be all. This is called the Montreal Cognitive Assessment Test. It's commonly used in primary care doctors' offices. It can give us a good indication if there is a problem, to tell us to dig deeper into it. If you completely ace this test, it doesn't mean that nothing's going on, but it means it's not as severe or not presenting itself. So the doctor would have to dig a little bit more, either doing maybe a more full neuropsychological assessment with a PhD neuropsychologist doctor that oftentimes takes a few hours to get that done, maybe do some imaging or something else to help with the diagnosis. But this is just an example of one of the tests that can be done. You can go to the next slide. This is an example of the different types of brain imaging that we have available. The panel on the left, the upper and lower, is something that is a special scan for amyloid protein. So we can see some of the specific Alzheimer's proteins, like amyloid is on the left, tau is the panel all the way to the right, and the one in the middle is actually a normal, just a regular MRI. So as you can see with the middle panel, MRI itself, we can't really see Alzheimer's on an MRI, but we can start to see hints of it if we start to see shrinkage of the brain tissue telling me that something else is going on. On the right, it's the tau protein that we can see on these specialized scans. These scans are available mostly in research, and the reason is because right now insurance companies don't cover for amyloid scans, so they're very expensive, so we don't tend to do them in just general practice. You can skip ahead. These are some of the commonly used medications for someone who does have a diagnosis of Alzheimer's disease. There's really two categories. One is cholinesterase inhibitor, and the other is called NMDA receptor antagonist, or Namenda. I'm not going to go too much into these because I'm going to get more into sort of where we are with development of other therapies. But these are just standard therapies, so you've got the names of some of those. You can go to the next slide. So haven't we found a cure for Alzheimer's already? There's lots of articles that will come out that will say, oh, there's a cure for Alzheimer's, it's out there, and you read the article and you find out that it was cured Alzheimer's in the Alzheimer's mouse model. So the reason why it does take us a long time to develop Alzheimer's medications, and there hasn't been really a new one since 2004, is because although we can find ways to treat the Alzheimer's pathology in what we call an animal model or mouse model, it doesn't mean it's going to translate over to human beings to be as effective. So we have to do very rigorous, what we call clinical trials in humans to determine, is this medication really better than doing nothing? Is it safe? Is it tolerated? And how much benefit will it give this patient? And so that's why the studies take a long time, and why it's so important for us to continue to have a broad range of clinical trials going on in Alzheimer's. You can go to the next slide. So the types of research that is going on now are both what we could call prevention studies, which I talked about a little bit, like the US Pointer study, looking at exercise, blood pressure control, cholesterol control, how can we slow down or prevent you from developing memory impairment. And then the other big area of research is therapeutic intervention. Are there medications that we can give that either stop or slow or completely halt the progress of an impairment in memory or Alzheimer's disease in general? So those are kind of the two big areas. I'm going to talk a little bit about both, and then we're going to go into more about nutrition and what we know about diet that can be helpful. Go to the next slide. So can Alzheimer's be prevented? We know that Alzheimer's can be likely the decline associated with Alzheimer's disease, the progressive memory impairment can be slowed down by diet and exercise. We haven't found yet that we think it can completely prevent the disease altogether, but we do think that if you keep your brain healthy throughout life, it'll take a lot more disease or more severe disease for you to feel the effects of it, for you to have memory impairment or difficulty functioning. So we do think that there are ways to do that. So some of the data we have, you can go to the next slide. Like I said, there's blood pressure control, cholesterol, glucose control, so good diabetes control. Exercise, there's been several studies already that have shown that exercise has benefits. So exercise is being incorporated into many studies right now, looking at how much can we delay the onset of Alzheimer's or memory impairment for somebody, or can we prevent it altogether? The typical rule of thumb is 30 minutes of a cardio workout 5 days a week, and cardio meaning a brisk walk or an elliptical or a stationary bike where your heart rate gets up a little bit, not intensely. And this is something where exercise should be guided by your primary care doctor if you do have other health problems. But it is something to be considered of, can you incorporate, if you want to do anything in your life today to help with your brain health besides joining this talk, what can I do to increase my activity rate safely? And what can I do to eat better? So that's where the mind diet comes in. I'm going to talk a little bit more about that. And the other thing I'm just going to mention briefly here is sleep. We are finding that poor sleep quality can affect your memory both directly and indirectly. If you get a poor night's sleep, the next day, your short-term memory is not going to be as good. If you get a good night's sleep, that'll reverse. But there are also chronic issues with sleep, like people who have sleep apnea or that chronic sleep-deprived state can actually increase their risk of developing Alzheimer's because it starts to affect the accumulation of amyloid and other proteins. So yes, poor sleep can affect your memory. So if you are having trouble sleeping and you're noticing that your short-term memory is bad the next day, it's likely due to sleep quality. So looking for ways to improve your sleep can be one way to improve your memory. You can go to the next slide. So I talked a little bit about exercise already. We do know that exercise is something that can help you keep your brain fit. There was a study that was done in Canada that said that if you exercise at least moderately, you can actually reduce your risk of developing Alzheimer's as you get older by sometimes up to 30 to 50%. So don't discount some of the things that you can do yourself, talking with your primary care doctor about keeping your brain healthy. They can be very effective, even if they won't reduce your risk to zero, it's going to reduce your risk sometimes by 30 to 50%, which if you accumulate several different preventative type of risk activities into your daily life, you can really start to control your risk and reduce it as much as possible. Go to the next slide. So one of the things about nutrition, we're going to get into the mind diet now, but just some general nutrition thoughts. Just go ahead and click through because it'll give you a few of them. Carbohydrates, and you'll find in the mind diet, which I'm going to talk about, there's really no carbohydrates. What we're finding is that refined flours and sugars are not good for our brain. They cause too much fluctuations in glucose, so the brain doesn't have a nice steady state of good nutrients going to it around the clock. So when you eat ice cream or cake or candy, you might notice that afterwards you might not feel well, you may not feel as sharp. So that's why trying to avoid carbohydrates is a good rule of thumb. Fruits and vegetables are high in antioxidants. They also help you control your glucose levels, which is also good for your brain. As I said, big fluctuations are not good. And then avoiding saturated fats. So we want you to get more of the unsaturated fats. Good cholesterol levels are healthy for your brain. Omega-3 fatty acids coming from food sources can be very good for your brain. Omega-3 fatty acids coming from a supplement has not been shown to completely reduce the risk of Alzheimer's, but we do think it's part of a healthy lifestyle habit. So it is one of the supplements that you could talk with your doctor about. Can I safely take this? Because all supplements, although they seem like you can just take them and there's no risk because you can buy them at Walgreens off of the shelf. There should be no risk to it. They do have risk, and some of the supplements can interact with your other medicines. So you need to review those with your doctor at a regular interval to say, would it be helpful for me to take an omega-3 fatty acid supplement? Maybe I don't eat enough fish, or I don't like fish, or maybe I should, would it interact with any of my other medications? Is a good conversation to have with your doctor. And then hydration. We live in Texas, it's getting up into the mid 90s. Hydration, if you are dehydrated even mildly, which happens a lot as you get older, you will not be as sharp, your memory will not be as good, and you will feel better if you drink more water and avoid dehydration. So that is another just general rule of thumb for brain healthy and really good health in general. Go to the next slide. So the MIND diet. So the MIND diet, M-I-N-D, and you can go online and Google MIND diet. This was a diet that was developed at Rush University. Actually, unfortunately, the researcher who did this, Dr. Morris, passed away this year, but she did really groundbreaking work in this area, showing that when she put these patients on a very strict, what she called MIND diet, and I'm going to tell you what that is, if the person followed it rigorously, did the same diet every day, didn't deviate at all, they actually found that when they followed those people out, they reduced the risk of getting Alzheimer's by almost 50% compared to people who didn't follow the diet. So diet can have a very beneficial effect on your brain health and prevention. For people who kind of followed it, had a 35% reduction. So not quite as much, but just following it, you can control this by looking at your diet and how can you improve your diet now that can actually translate into immediate, prevention of your risk. So let's go into what exactly is the MIND diet. You can go to the next slide. So what is the MIND diet? These are the things that you eat. Green leafy vegetables, at least once a day, 5 servings of nuts a week, berries, 2 or more servings a week, beans, at least 3 a week, whole grains, avoiding, again, processed flour and sugar, so avoiding white bread, sugars, cakes, candies, all the good stuff. Fish at least once a week, chicken or turkey at least twice a week. Using olive oil for cooking is known to be healthy. And then in this, they say 1 glass of wine a day, but again, really being careful with that. We're actually finding that although we usually advise a little bit of wine is okay, we are finding that people sometimes go a little bit overboard, and we're not finding enough benefit from alcohol intake as the risk. So be very mindful of that. You don't want to overdo it because that will have negative effects on your brain. You can go to the next slide. So what is the best fish choice? So this came up, the reason why fish is important, that's the omega-3 fatty acids. And as I said, when we've done studies of supplements for omega-3 fatty acids, the data on how much it can actually prevent Alzheimer's is not as strong as when you eat a diet that's high in omega-3 fatty acids. So that's why my rule of thumb is always, look at your diet first. How can you improve your nutrient intake before you go to supplements? Supplements are called supplements for a reason. That's why they're not called primaries. Your primary should be your food sources, and then supplements are filling in places where things like B12, where as you get older, we don't absorb B12 as well. So oftentimes some type of B12 supplement is needed. So anyway, if you are eating fish, your best fish choices, not every fish is the same. Sardines and anchovies actually are the highest in omega-3 fatty acids. So not many people eat a lot of sardines and anchovies, but that's probably where there's some villages in Greece and Italy where they are called blue zones, where they live long, healthy lives, low risk of dementia. It's probably because they do eat a lot of this fish in their general diet starting from birth. Other fish that are more familiar to the US would be Atlantic or Pacific salmon. Wild would be better over farm raised because farm raised does have mercury levels. Trout actually is a good source of omega-3 fatty acids. Oysters are about the same as if you were to take a 2 gram of a fish oil. And then the lowest are things like shrimp and catfish and orange roughy and cod. So do try to go more towards the fatty salmon type fish. Go to the next slide. Things you want to avoid for the MIND diet. Eat less red meat, really less than 4 servings a week. Avoid margarine and butter. Really not a lot of cheese, not a lot of pastries and sweets, and no fried food. So anything on the McDonald's menu except for a salad is not part of the MIND diet. You can go to the next slide. So this is what we did as a summary of the MIND diet. We actually give these magnets out at our office, and this is oftentimes what we'll advise people on is really what they should be eating. And take this to the grocery store with you when you're making up your list of what food should I be buying today to improve my diet to make my brain healthy. And so that's why I like to put up this visual, and I'm going to leave it as my last slide so that we have 10 minutes to go through questions. And I'm going to both Jennifer and Julie, if you want to tell me if you want me to look at the chat box or if you want Jennifer to read questions to me, you can tell me which would be better. So
yeah, we can read the questions. I think you actually covered a lot of them as you were talking.
Okay. Let me make sure. So yeah, just to kind of review, just to be sure. We talked about diet, we talked about omega-3. So I'll keep talking a little bit, and then what we'll do is if there's a question that comes up that I didn't cover yet, but otherwise we can go through. Okay, questions about what are the best grains. So the best grains would be whole grains. So it's going to be more wheats, again, staying away from processed flours. And the question is, where does tuna fall into the fish list? So tuna would be, if you do get fresh fillet tuna, it's not as high in the omega-3 fatty acids as something like salmon. And when you think about salmon, if you ever notice salmon has that sort of greasy kind of look to it, it has a little bit more fat streaks. The fat streaks are actually where the omega-3 fatty acids are coming from. So that's why something like tuna, although it is a good, healthy protein source, is not going to have as much omega-3 fatty acids. So again, on omega-3 fatty acids, the question came up a few times, does omega-3 prevent dementia? It does not completely prevent dementia. It is part of a brain healthy diet. It does have some benefits for you, but it is one of those supplements that you need to review with your doctor, because omega-3 fatty acids do have some effects on other medications. They can thin the blood, but omega-3 fatty acid in your diet, such as through fish, has been shown to reduce your risk of dementia. So someone's asking if I can share the PDF of the magnet. I think Jennifer Trotter and Jennifer Vo, we have that magnet PDF somewhere, I think. So we can probably share that somehow. I'll leave that to Jen Trotter. So
Yeah.
Jennifer Trotter at GAP can help us get that out to anybody who might request it.
Of course.
And then, should I use oil instead of butter in my food? So yes, so one of the Mind Diet mainstays is, as I said, part of the Mind Diet is really based in what's called the Mediterranean diet. So when you think about Mediterranean countries, that's Italy, Greece. Primarily, they're using olive oil as their primary oil in all of the cooking, both for preparation and then for like garnish. We talk about salads and things like that. So the thought is that when you do use some type of healthy oil, olive oil is the main one that we think of, that is a healthy oil. Butter is not a healthy oil. Butter has a lot of unsaturated fats. It's actually not considered brain healthy. So anywhere that you can replace any of those fats where you used to use butter, try to see if you can substitute an oil like an olive oil instead. And a lot of times you just have to Google it. You can usually look for brain healthy alternatives when you are baking. Sometimes there's even like the Earth Balance butter, I think you can sometimes use for baking and things. They've got some baking sticks that are a good butter substitute that you can look for. It's going to have a slightly different flavor, slightly different consistency, but it is good for you to look for ways to substitute in. If you do want to have a sweet, how can you substitute in some of these healthier substitutions to make the dessert not quite as bad? And okay, yes. So there's just some questions going back and forth. I'm just going to talk a little bit. I'm not going to show the slides because I want to stay on the brain healthy diet slide, but just to give you some overviews about where we are with Alzheimer's clinical trials in general. Right now, there's about 109 different medications that are in what we call the pipeline for Alzheimer's treatment. So that means there's somewhere in the research community, somewhere in the world, someone's looking at it as a potential treatment. It's either in the very early stages in what we call a phase 1 study, where we're just looking at, is this drug safe to take, to give to a human? Or is it a stage 2 or stage 3 where we start to look at, is this medication better than giving the patient nothing? So is it better than placebo? So there's about 100 different medications that are in the pipeline, meaning that for us to be able to do studies to look at all of these 109 different medications, we'd have to have about 54,000 volunteers or more to go into studies so that we could do the proper clinical trials to tell all of us, is this medication going to work to treat Alzheimer's or some other dementia? So that's where clinical trial research is so important. And even if you're a young, healthy person, even if you don't think you have any memory issues, but you have some memory concerns, looking on at the GAP website, where you can actually go in and start to look at where are sites that are doing research in your area. There's also something on the Alzheimer's Association website where you can look at what are the clinical trials in my area. Getting involved and being a part of helping us find the cures is really an important part. And it's also a great way to invest your time and to do an activity that's both positive and really just enriching. So we couldn't do the research without all the volunteers that we have. They give a great deal of their time and their energy and their bodies to science so that we can solve the problem of finding ways that the next person that says, I think I have memory issues related to Alzheimer's, we can say, don't worry, there's a medication that we can stop this now. So that's why the research and the volunteers are so important. The next part, someone's asking, what's your opinion of the association between microbiome and memory? So this is a really great question. At the beginning of the slide, I know I put at the bottom, I said, gut microbiota. So the microbiome, just so you know, we all have bacteria that live throughout our gut. That's why a lot of like probiotics are out there to try to balance, should we have more of the good bacteria in your gut versus the bad bacteria. The bacteria in our gut oftentimes are also on different ratios of good versus bad, depending on how inflamed or how much inflammation is in our body. So we do know that having a really healthy gut bacteria balance is helpful to have a lower inflammation in our body overall. When you do have it off balance, so oftentimes the Western diet does not really give our gut the ability to get into a good balance of bacteria. And it is a source of inflammation in the body. And so there's been some associations when we look at people that have poor gut microbiomes or microbiota outlook or balances, associations with things like Parkinson's disease. So we do know it's associated with some neurologic conditions. We think it's also associated with Lewy body disease. And we also think that it may be related to other diseases. So it's really hard to change your gut microbiota just by saying, I want to do that better. But by eating healthy, by having more fruits and vegetables in your diet, it does help the gut to naturally cleanse and get to the right balance. When you really bombard your body with a lot of processed foods, if you bombard your body with a lot of sugars, that tends to lead to more inflammation and less of a healthy balance of bacteria in your gut. Yes, everyone has bacteria in their gut. That is a normal thing. To have bacteria in your large and small intestines, mostly in the large intestines, is normal for everybody. It's the balance of the bacteria in your gut that is whether or not it's healthy or not. There's a good question here about meditation to change the brain if you begin with an early cognitive impairment. So meditation to me goes along with meditation really goes along with kind of a healthy mindfulness. So if you are really part of a healthy lifestyle, really trying to exercise your brain, keep your brain healthy, keep your body healthy through physical exercise. The other part is looking for ways to lower risk and that real being anxious all the time, that fight or flight phenomena that happens when we get overloaded. So people that are very anxious about work or stress in their personal life, financial stressors, job stressors, having meditation or doing some ways to relieve some of that stress, we do believe is healthy for your brain function. We do think there's also health for the neurons in and of itself. Stress, if the body is in constant stress all the time, it does tend to have negative long-term effects. So if you go through a really bad place in your life where something bad happens, that's going to happen, but having that stress carried through day to day, year after year after year, can start to have long-term effects. And so meditation is one of the ways that has been shown to be beneficial in lowering stress, having more mindfulness, and part of a brain healthy regimen. So we are out of time at 2 o'clock. Yes, I want to say thank you, everyone. You had great questions. Really enjoyable to talk to the group this afternoon. And I know that Jennifer and the GAP, the Global Alzheimer's Platform Foundation, will assist in getting, if there's any follow-up questions or information that we want to get out to people, we'll try to share that with you as well. And we'd love to keep this as an ongoing conversation, so we hope to have more of these sessions for you in the future.
Thank you, Dr. Kerwin, and thank you all for joining today. We'll look forward to having you on our next webinar.
Great.
Have a great afternoon.
Thank you, you too.
So meditation can lower stress.